Good morning, everybody. Sorry for the false start this morning. I'm Dr. Jyoti Patel. Welcome to my Facebook Live. I am an integrative practitioner, also board certified in pediatrics and internal medicine. So today's topic is liver detoxification and fatty liver. I had one of my comments in one of my other posts ask me specifically to do one on fatty liver. So here's a post just for you. So fatty liver. So many people come to my office, they get routine blood work. You might be one of those people that go to your doctor and get routine blood work that shows that you have elevated liver enzymes. Good morning, Karen. So you might find that routinely every year your doctor says something like, your liver enzymes are mildly elevated. Chances are you have something called fatty liver. I want you to work on losing weight, and that should fix your fatty liver. Well, I'm here to tell you that there's a lot more to that story, so tune in. So when you have elevated liver enzymes, let me just preface it with, it's important to get a proper workup. Make sure that you don't have infections that are causing your liver to get disease, such as Hep A, Hep B, Hep C. Make sure you don't have a genetic condition like hemochromatosis or have any other types of medications that might be affecting your liver. Sometimes the most common reason is alcohol. So once you've removed all of those common things, you might be suffering from something called fatty liver. Now, it's not necessary that you have to be overweight to have fatty liver syndrome. You can actually be skinny and have elevated liver enzymes. So let's talk about how the liver works. So here's my analogy on how the liver works. So what do the doctors know about liver disease? Imagine a water treatment center. So you have your house, and every day you use the sink, you use the tap, you use the toilet, you flush the toilet, you take a shower. Where does that water go? So that water goes through your pipes to the sewers, and then from the sewers, it collectively goes to something like a water treatment center, right? And then magically, that water gets filtered, cleaned out, and recycled back into your tap. We don't think much about what happens to that dirty water and how it ends up clean in your tap again. But the body does exactly the same thing, guys. So when your cells make waste, these are like little homes, and they make waste, or you consume toxic material, the veins, which are basically the sewers, take this dirty blood to the liver, which is your water treatment plant. Okay, and the liver's function is to clean your blood and then recycle it back up into the cells with the nutrients that your body is actually consuming. So think of this process happening every 6 minutes. So every 6 minutes, your blood filters through your liver. Your liver then detoxifies, cleans, removes toxins, and puts that clean blood back into your system. How amazingly cool is that? I think it's cool. Okay, so when the blood, the dirty blood, comes through the liver, there's two phases. Okay, why is this important? Because if you have a fatty liver, or you have a large, good morning, Chris, you have a large abdominal girth, you have a waistline that's spreading, and you have a lot of visceral fat, and you've been dieting, and you've been exercising, and you've been struggling, and you are shamed by your healthcare providers, and you can't get that to go away, this is why the liver is malfunctioning. Okay, so there's several things I want to tell you about the water treatment center, also known as your liver, that's helping you detoxify. And when those toxins can't get out, then they seep into fat cells because they're fat soluble. So they start seeping into your abdominal fat, which causes now the fat to become dysfunctional, which then that dysfunctional fat continues to grow and secrete hormones that make you insulin resistant, make you sick, give you diseases, right? And you start feeling these symptoms. You have brain fog, you have fatigue, you have depression, anxiety, anger, irritability, your joints hurt, and you have all this stubborn fat that's just not going away. It has to do with the fact that the toxins are not being properly removed by your water treatment plant, and you're recirculating toxic waste into your system. Okay, so in order for the liver to do its job, it has two parts. It needs to take the toxins that are fat soluble, and they have to make them into water soluble products. So first it has to neutralize the toxins. So you say to me, what does the liver need to neutralize toxins? Well, guess what? It needs nutrients. And when you're deficient in these powerful nutrients, the liver can't do its job, okay? So the first phase is making the toxins neutralized. When the liver makes these toxins neutralized, it makes a free radical substance. It makes basically the waste matter that it needs to get rid of. So you need more nutrients to get rid of that waste. Then the second phase is it makes it water soluble. And in order to make the toxins water soluble so that you can excrete it in your stool and excrete it in your urine, there's more nutrients needed. So if your body is lacking nutrients, you're not going to do this process properly. Toxins are going to back up into your system, seep into those abdominal fat cells, cause dysfunction, secrete inflammatory signals, which is going to then lead to disease and pain. So I don't know if that all makes sense. So here's the key question. You might say, well, what does the liver need? What can I do to help my liver along? The first thing is vitamins. So the first process of things, the first part where it neutralizes toxins, it needs things like glutathione. It needs B vitamins. So B1, B2, B6, folic acid, B12, okay? What else does it need to make it water soluble? It needs minerals. It needs important minerals like zinc, copper, selenium, manganese, okay? It needs vitamin A, C, E. These are powerful antioxidants that neutralize those toxins. If you don't neutralize those toxins, they become inflammatory. They cause free radical oxidative stress to your cells, causing damage in your liver and everywhere else. 20% of people with fatty liver go on to cirrhosis of the liver. So there's chronic inflammation and damage, and those liver enzyme tests that your doctor told you about, those are distress signals. Those are SOS signals telling you that your liver cells are not doing well. They're not healthy, okay? Now you might say, what's the most powerful thing that the liver needs? It's an antioxidant called glutathione. You might have heard of it, also known as NAC. So in the emergency room, when we doctors see somebody with Tylenol, overload, or they see them with toxicity of Tylenol, we give them NAC, which is N-acetylcholine, to help them break down that Tylenol because we know it protects the liver from Tylenol toxicity. So glutathione is basically the end object that you need. You say to me, can I get glutathione? Good question. You can actually get glutathione from sulfur-based compounds that are found in fruits and vegetables. So here's the thing: garlic, onions, asparagus, avocados, cruciferous vegetables like kale and broccoli and cauliflower and cabbage. It's all in your garden. It's all in your backyard. These are important phytonutrients that increase your glutathione levels that help detoxify those chemicals and toxins in your liver. So you don't have to look far, just your refrigerator and your vegetable drawer. And you can actually eat foods that are rich in glutathione producing molecules, sulfur compounds like garlic, onions, and crucifers. Okay, so vitamin A, you get it from leafy greens. So eat 3 cups of leafy greens, everybody, because that's going to help detoxify your liver. Also going to help protect your cells from oxidative stress. Vitamin C, eat fruits and vegetables that are rich in color, right? So you've got your strawberries, blueberries, oranges. Go for it. Eat your fruits because they are also potent in helping protect your liver from oxidative stress. Vitamin E, you get them from nuts and seeds. So throw those nuts and seeds in your salad every day. That's the best way to get your nutrients, is not through a pill or a tablet, but actually adding them into your meal plan. Okay, so what am I saying? I'm saying in order to help the liver, you have to do 2 things. One is be careful about the amount of toxins your liver has to process, okay? If you're eating a lot of processed food, you're eating a lot of artificial sweeteners, hydrogenated fats, refined sugar, you're eating things that are loaded with pesticides, you're eating meats that are factory raised, you're not going to get ahead of the liver. You're actually going to burden the liver's going to get tired of doing its job, those fat-soluble toxins are going to get seeped into fat cells, that's going to hoard in your belly, and then of course it's going to cause dysfunction, it's going to cause inflammation, and it's going to tumbleweed to having disease. So the first step is clean up your diet. Try to eat whole foods. So my first step and my only step always is try to go with a whole food, plant-based diet. If you're not sure where to start, there's a program called the Whole30 that goes over how to remove processing from your diet. So that's always the first step. Don't look for a supplement, don't look for a pill, don't look for a quick fix, don't go for a gimmicky 7-day detox program that's gonna take your money but really not help you in the long run. So rather than taking a fish, learn how to fish, right? Get your body clean on a daily basis so that once in a while, if you go on vacation and you have, your glass of martini, or you end up eating a rich meal, or you end up eating some processed food, your liver is so robust, your water treatment plant is doing such a great job, it's gonna filter those toxins right out into your urine and your stool. So make sure that you're keeping your liver nice and healthy. Okay, so aside from these nutrients, we talked about glutathione, there's also SAMe, coenzyme Q10, minerals like zinc, selenium, and manganese that helps with that. Good morning, Claire, or good afternoon to you. So just know that there are things that you could do in your diet, but sometimes people will ask me about supplementation, and there are specific ones that can help support the liver. One in particular that I want to tell you about is milk thistle. Now, I don't recommend supplements very often, but this one actually has some really good scientific, evidence-based research to back up its use. So they did this experiment on animals, and I know, that's sad, I don't like it, but I want to tell you about this particular experiment. They have a poisonous mushroom that they fed to these animals, and they gave them milk thistle before they got the poisonous mushrooms, while they were eating the poisonous mushrooms, and after. And what they found was when they pre-medicated these animals with milk thistle and gave them this liver toxic poisonous mushroom, it did nothing to the animals. They did not die. The animals who didn't get the milk thistle clearly had liver poisoning and died, but the milk thistle actually had hepatoprotective effects to help keep the liver from getting damaged from toxins. It increased glutathione levels by 50%, which is a potent antioxidant that helps protect the liver. So milk thistle, 300 milligrams, 3 times a day. Always talk to your doctor before taking any supplement. Make sure it doesn't interfere with any of your medications or health concerns. And I'm not making a prescription recommendation. I'm just reminding people that this is education. And the studies show that milk thistle does have hepatoprotective effects, and for people that are trying to reverse toxicity, it can actually be helpful. So along the way, tell me where you're from. Also ask questions, because I love this to be a conversation. And I want to make sure that if you have any specific questions about liver toxicity, detox, or fatty liver, I can answer them. Good morning, Liz. Thank you for joining me. Okay, so what kinds of things that you need to be wary of that might be poisoning your liver? First of all, it's always medications. Use them judiciously. Make sure when you go to see your doctor, you always review your medication list. Ask them, are there any medications that I no longer need, or any medications that I can work to get off of? People assume that your medications are required, and I'm here to tell you they're to help you, but they're not required. You can try to work on lifestyle to remove these medications from your pill box, and then take the load off of your liver. Also, good morning, Vina. Also remember that supplements don't have, you don't have to take supplements either. Supplements are not all made equal. There are a lot of fillers and binders, chemicals, dyes, additives, things that you don't want to add into your liver in these supplements. Be very careful. Read ingredients. When you buy food, read ingredients. When you buy medications, look at the ingredients. When you buy supplements, vitamins, read ingredients. Everything that you can't pronounce, everything that didn't exist 100 years ago is a chemical. And every chemical, your liver has to clean out and put in your urine or stool. Liz has a question. She says, how do you know you have a bad liver? Liz, this is really an important question. You definitely want to get your routine lab work. So yes, you should get routine labs. A blood test called a comprehensive metabolic panel has your blood sugar, has your kidney functions, has electrolytes, has things like protein and albumin, has calcium levels. also has liver enzymes like bilirubin and AST and ALT and alkaline phosphatase. And this is a routine lab. It's not something special. It's dirt cheap, and you can get it done at any time. Here's the trick about that, though. If you are let's say a daily drinker and you have chronic liver disease, you can fool your doctor because the liver enzymes, this SOS signal, will go down and you'll assume everything is fine. So don't go just by the idea that your liver enzymes on your lab tests were normal, even though that is a good sign. It could actually be something more than that. So you might have low platelets, right? You might have an enlarged MCV, your red blood cells might be enlarged. There might be some other soft signs on your blood test that tells your doctor that there's something wrong with your liver. You might have feelings of fatigue, brain fog. You might have trouble losing weight. You might have joint pains. These are all things that might signal a poor metabolic detoxification process. Your body is also fighting homeostasis all the time. It's trying to get rid of these toxins for you. But if it gets overburdened, then you start feeling those symptoms. And that's another way of knowing that maybe your liver is not as healthy as you think. Vina has a question. She says, you mentioned minerals like zinc, selenium, magnesium, etc., but you did not say anything about magnesium. Absolutely magnesium. Magnesium is a trace mineral, has a critical and essential role in detoxification process. I try to make these talks as simple as possible. I don't want to overburden people with phase 1 detoxification and 2 and talk about methylation defects and talk about the cytochrome P450 pathways. For sure, if anybody has any specific questions about the liver and how it does its work, I am here for you, happy to explain it in depth, but as my husband tells me, it's probably not a good idea, and to stick to the easy stuff. Okay, but I'm here if you have questions like that. Marco says, what foods can I eat to reverse kidney disease? Kidneys are also part of the detoxification process. I mentioned how the liver has to make toxins from being fat soluble to water soluble. That's its job. Then once it's water soluble, then the liver sends it through the blood, sends it to the kidneys, and the kidneys have to filter out the toxins. So toxic heavy metals, right? Mercury, arsenic, zinc, lead, these things can actually be harmful to the kidneys. So again, Marco, when we talk about protecting your kidneys, getting rid of toxins and heavy metals and pesticides and processing is also part of kidney protection. So without doing that, nothing else really matters. Now, when you have chronic kidney disease, you do go to a nephrologist. They'll put you on a kidney-specific diet to limit the amount of protein that might burden your kidneys. They'll tell you to reduce your salt because that can burden the kidneys. So there's a specific renal diet that you can look up specifically for kidney. But the liver and the kidney are both part of the detoxification process. There's not just one thing. Removal of processing and preservatives is important, and removal of heavy metals, removal of pesticides, all of those things are important to the kidney as well. Hi, Carol. All right, Marco also says, and can having it lead to or being caused by liver disease? Again, going back to the same process. I am a generalist. I practice internal medicine and pediatrics. So I look at the whole body. I get a little bit upset when you have a doctor for a specific organ system. Like you have a doctor for the kidney, you have a doctor for the liver, you have a doctor for the brain, you have the doctor for the heart. And then one doctor doesn't want to have anything to do with the other body part. And I just think that's odd because they are part of the same family. They're all doing the same thing. They're keeping you in balance, and they talk to each other and they work off of each other and they need each other. And when one organ gets sick or isn't doing its job, it puts stress on the other organs. So absolutely, Marco, when you have a sick liver, it can cause a sick kidney or sick kidneys. Carol says, what about organic sulfur? Again, sulfur compounds that are found in onions, garlic, cruciferous vegetables are by far the best sulfur compounds that your liver needs to make glutathione. So glutathione is the antioxidant that helps detoxify the toxic metals. Of course, we talked about, like Veena mentioned, magnesium and minerals like zinc and selenium. These things help bind or chelate the toxins and make the toxins water soluble to remove them. So my first and foremost is always eat your vegetables, eat your minerals, get good, clean products. Liz says, if we do a detox, will the detox we do detoxify all our body? Again, the answer is yes. So remember that every organ system has a role to play. If you work in an office and you have a receptionist, you have somebody working on the phones, you have somebody working in the back, one person's job most definitely affects the other. If one person doesn't do their job, it puts the stress and burden on the rest of the staff. It causes them to have to do more work. Not only that, but their work starts to affect their work, right? We can understand that in our day-to-day life. But your body is exactly that. It's a well-oiled machine. It needs every part to do its part. Your GI tract, where you put nutrients in, if it's unhealthy and your liver is waiting for zinc and it's waiting for manganese and it's waiting for selenium, but your gut is overrun by bad bacteria and you're not absorbing nutrients because you're taking an acid reducer and your proton pump inhibitor is blocking acid from helping you break down food, doesn't really matter what the liver wants to do. If it can't get the nutrients from your GI tract to get the detoxification process in place, then the liver's going to fail. And if the liver can't detoxify these toxins, they seep into your fat cells. That causes your visceral fat to increase, right? That visceral fat then causes adrenopectin levels to drop. So then you become insulin resistant. Now you have diabetes. Now your pancreas is overworking. It's increasing insulin to try to compensate. And that causes your blood sugar levels to get all over the place. Guess what? Blood sugar is an inflammatory agent. So then you get inflammation in your arteries and you start getting plaque and you develop heart disease and you develop stroke. So I hope that makes sense, guys. I know I'm kind of going off on that, but it's every body part works together. One part doesn't work, the other part gets affected. Okay, thanks, Liz, for that feedback. Let me know if you guys got it, okay? Because I don't want to, I definitely want to clarify if I don't make sense. Liz says, does celery juice detoxify our body and our toxins? And the answer is yes, not because it has something magical, but you've got water content, you have fiber, right? You have phytonutrients that come from plants, like we talked about. So not only does it help your gut, right? The fiber increases the prebiotics that your bacteria feed on. It helps that gut digest with that fiber going through. The water helps the kidneys. The water helps the GI tract. The nutrients that you get from celery can help support some of the liver's functioning with the vitamins and the minerals that you get from the soil. Absolutely. So now that you've brought up vegetables, let me talk about two things to do, what to do and what not to do. So what things should you add to your diet, right? So we talked about the good stuff. But when you're trying to find the bad stuff, go to the EWG, the Environmental Watch Group.org. Look up the Dirty Dozen. The Dirty Dozen is a published list of the most heavily pesticided produce available. If you want to burden your liver with lots of pesticides, then don't buy organic, buy commercial, and this is the list that you don't want to ignore. But if you want to reduce your toxic burden, if you want to get rid of the heavily pesticided produce on the market, look at the Dirty Dozen and try to at least buy organic when it comes to those 12. There is another list that they publish called the Clean 15. That actually is the conventional produce is just as good as the regular stuff, the organic stuff. So you can buy Clean 15, you can buy commercial. They also have a list for fish. So it's called seafoodwatch.org, and you can find things like which fish have the most mercury and heavy metals in them, which fish are safer to eat. Again, finding the right source of food is important. I talk about this all the time. If you're gonna eat meat, then choose grass-fed or local farmed. Look for organic if you can, just because they're given antibiotics, they're given hormones, they're given feed that is sprayed with pesticides and organophosphates like Roundup. So their fat, because the toxins are fat soluble, their fat absorbs all of those toxins. And when you eat these animals that have these toxins in their fat, you are thereby consuming those toxins as well. So thanks, Veena. She says my explanation is amazing, and she thanks me for that. I just love it when I can make sense to people. It really helps to see the overall picture. Thank you. Yes, it's the overall picture. Your body is a restoring, regenerating, repairing, amazing mechanism. And if you give it the right nutrients, if you give it the right information, it actually does its job well. It wants you to be well. It wants to be balanced. Whether it's your electrolytes, whether it's your toxin levels, whether it's nutrients, it's working so hard all day long to keep things going. We're the ones putting a wrench in the plans. We're the ones, tripping over ourselves. So let's fix it, right? Okay, so what else should you remove? Supplements, unnecessary supplements that have fillers, binders, heavy metals. Remove things that, if you look at the ingredients list, which you must always look at the ingredients list, and it has things that don't make a lot of sense, you can't understand it. It has a lot of alcohol, has a lot of xanthan gelatins, has a lot of colors, dyes. I don't care what brand it is, if they're putting that in their ingredient list, toss it in the trash. Okay, try to get some cleaner products. There's so many products that are doing a great job. They publish their certificate of analysis where they get their raw materials. They put seals of approval on there like GMP and Consumer Labs and NSF. Look for cleaner products. Remove as many toxins from your diet as much as you can. Remove as many toxins from your medicine cabinet as much as you can. Pesticides also come in a lot of other forms. You've got cleaning supplies, right? Try to go green and clean with your cleaning supplies. Try to figure out what you're giving your children, what's in your bath, what kinds of soaps are you using, what kind of shampoos are you using, what kind of makeup are you applying, what kind of lotions are you using. These are also toxins. They make it into your system, and your liver has to do the first pass cleanse, right? Or your kidneys have to cleanse. So be careful about what you put on your skin. Carol says, love what you do. Great talks. Thank you. I appreciate it. My goal is to educate. I have no other intentions this morning. So if I make sense, it always makes me feel good. So thank you for making me feel good. Liz says, does taking probiotics help our liver and other organs? Yes. So, again, there's more and more science coming out when it comes to probiotics. The problem is the studies that there's probiotics you get from food, right? So you got fermented food, yogurt, kefir, sauerkraut, kombucha, tempeh, miso soup. You've got fermented vegetables. That is a given. Cultures like Japan and China and Korea and India, places where they eat fermented food, there's a tremendous amount of health benefit. Now, in the Western world, we are trying to put it in a capsule. We're putting everything in a tablet. We're trying to monetize everything. And the problem with that is there are no good studies to show that taking it in a capsule form is as good as taking it in its real form, okay? So going back to eating real food, it's always my first thing. Incorporate real fermented food in your diet, get those probiotics in. I'm a big fan of gardening, as most of you know, so I recommend getting a garden and gardening. So that way you get that rich soil on your fruits and vegetables, and then gently rinse them off, and then eat that fruit and vegetable. You're gonna get really healthy bacteria from the soil that are gonna work with you to help you digest. That's the real probiotic. Now, if that doesn't sound appealing and you have limitations and you wanna take a probiotic, fair enough. For sure, you can buy a commercially brand. Just vet it really well. Make sure that you're actually getting what you say, what the bottle says you're getting. Thank you, Liz. Carol says, what about Oren? I'm not sure what Oren is, O-R-E-N. If you can explain that a little bit more. What about prebiotics? Prebiotics, for sure, are vegetables that the probiotics like to eat. So yes, you can take it again in tablet form, but you're gonna hear me say this over and over again. Bacteria love to eat vegetables. So you've got your onions, your garlic, your chicory, your inulin, your artichokes, your carrots, your cabbage. Those are prebiotics. Those are fibrous material that feeds your good bacteria. So first you gotta make your gut healthy. Eat good vegetables. Aim for 8 to 9 vegetables a day. When I say this, people sort of look at me and go, I barely get one. I tell them, keep working up to more and more vegetables. The lion's share of your plate should be vegetables. 80% of your plate should be vegetables. I don't care if you cut out beans and legumes. I don't care if you cut out meat or eat meat. All those things people ask me questions about. That's your cultural preference, your genetic background that determines that, your nutritional needs, your beliefs. And so I won't get in the way of that. But I will tell you that don't skip on the vegetables. They have powerful vitamins, minerals, phytonutrients, and fiber. All of it good for your body. Liz says, buy okay, probiotics okay. I don't usually make any specific recommendations for products because I'm not affiliated with any companies. But check out your product. Make sure that they have third-party verification labels on them so that you know that the product has been vetted by another company and that it's, that it is a good, validated product. Liz says she has horrible allergies. Absolutely understand. Then find a local farmer's market. Here in Arizona, we have so many good places where we can buy locally grown produce, and we have amazing farmers that do a great job growing organically. So look in your neighborhood, look in your town for farmers markets on the weekends if you can't make it there during the week, and invest in yourself. I tell people when they say they can't afford things, I tell them it's an investment in yourself. And when we are motivated, we find the resources to get what our body needs. So there's no excuses for eating potato chips and pretzels and processed food. If you have the resources to purchase junk food, then you for sure have the resources to purchase real food. Jennifer. Jennifer says, what foods are good for neuropathy? Okay, we'll swing over to the left a little. Neuropathy is also part of the same phenomenon. There's so many reasons for neuropathy. When you have an elevated blood sugar level, we talked about that cascade of how things happen. When you have insulin resistance, when you have elevated blood sugar, sugar actually is a toxicity to the nerves. So going back to nutrition, first and foremost, cut out the sugar. Cut out the processing, cut out the heavy metals, cut out things that could be toxic to your nerves. So things that are with fillers and binders, things that are processed heavily, things that have chemicals and dyes in them, they're neurotoxic. So if you're trying to protect nerves, first thing you got to do is eat real food, right? Now, what else? So B vitamins. When I talk about nerve health, I tell people take B1, B2, B6, B12, folic acid. If you can get it in your food, that's best. If you can't, then you can supplement with nutrients like the B vitamins to help with neuropathy. There's another supplement called alpha-lipoic acid that can help with neuropathy. It's a potent antioxidant that can help protect the nerves from cellular damage. You could take acetyl-carnitine, that helps as well. So there are some supplements that sometimes can help with neuropathy, but if you're trying to protect your nerves, eat foods rich in folic acid and B vitamins, try to avoid toxic metals, try to make sure your B12 levels are optimized through food sources or supplementation. Try to make sure that you're getting plenty of good minerals, like we talked about, like Veena talked about, magnesium, potassium. Nerves run on electrical currents, so they need minerals. So make sure you do that as well. Okay, all right, so aside from nutrition, because I know I kind of beat that horse to death, in addition to that, you could use steam, sauna, hot yoga. So sweating is another way to detox. So if you like sweating, which I do, but some people don't, you can work on exercise and get that sweat going. When you mobilize fat through exercise, it detoxifies, and when you sweat, you actually then secrete all those toxins out of sweat glands. So sweating is a great way. Saunas, hot yoga, things like that. Massage. Get into the habit of getting a monthly massage. That's a great way to release a lot of those toxins that are seeped into your subcutaneous fat and your myofascial tissue to help mobilize the toxins so your body can detoxify. So, and then it's the most important one is detoxify your mind. If you are stressed, if you're overworked, if you're not sleeping, if you're not doing all the things for self-care, it actually causes toxicity in the system, elevates hormones that increase oxidative stress, it lowers your immune system, increases your risk for pathogens and infections, which can affect the function of the liver. It can actually slow down metabolic processes. So stress is actually one of the top things you should be working on if you have a fatty liver, if you have problems with weight gain, if you have brain fog and fatigue and and systemic symptoms. Remember that the body is a complete unit. Everything affects each other. Everything touches each other. Thank you, Jennifer, for showing up this morning. I think that's it for today. I'm going to wrap it up. If you guys have any other questions or comments, please don't hesitate to add them into the section. I'll take a look and answer them the best that I can. I appreciate you joining me. I'm going to try again first Saturday of every month to do a live. I'll post videos on a regular basis on different topics that people have asked me questions about, or post any articles that I think are helpful for people to learn and take back control of their life. And so see you in a month, and then please continue to follow me on my page as I share more medical information. And you're welcome. Have a great day. Bye-bye.